Hello and welcome, everyone. My name is Renee Garrett, and I'm your Speech Therapy PD podcast host for Brainstorms, Functional Neuro-Rehab for SLPs. Before we get started, we have a few items to alert you to. Each episode is 60 minutes and will be offered for 0.1 ASHA CEU. Here are the financial and non-financial disclosures. Dr. Anthony D. Koutsoftas is a full-time employee of Seton Hall University and may reference his place of employment during this talk. He's the owner and sole proprietor of the Speech Guy PLLC, a speech and language consultation company, and moonlights as a stand-up comedian. Dr. Koutsoftas receives an honorarium for his participation on this podcast from Speech Therapy PD. He has no relevant non-financial relationships to disclose. My financial disclosure is that I'm the owner and founder of BrainBridge Connect, and as the host of this podcast, Brainstorms, Functional Neuro Rehab for SLPs, and other educational webinars, I do receive financial compensation from Speech Therapy PD. I'm also an adjunct instructor at James Madison University and Old Dominion University. My non-financial disclosure is that I'm the secretary for the Communication Disorders Foundation of Virginia. Questions can be written in the chat box or the Q&A and will be answered throughout the presentation. Now, without further ado, we welcome our guest, Dr. Anthony D. Koutsoftas, PhD, CCC-SLP, who is an associate professor of speech-language pathology at Seton Hall University, where he directs the Reading, Oral Language, and Writing Lab. The lab is dedicated to improving language and literacy outcomes for school-age children. In addition to his academic role, Dr. Koutsoftas is the sole proprietor of the Speech Guy PLLC, a research and professional development consultation company. So good to see you, and thank you for being with us.
Thank you for having me. I'm so glad to be here.
Yeah, so as I mentioned to you, it's always kind of fun to start with how each of us came to the field of speech-language pathology, because I feel like so many of us kind of either landed accidentally, or there's a lot of people who knew from an early age they wanted to be an SLP. So kind of tell us your journey, your why, what led you to this profession?
I think that's a great question to start on. So I think I'm one of the people, I still don't know what I want to be when I grow up, but I will give you a little bit of a history. I did know early on I wanted to be a speech therapist, speech language pathologist. I was in high school, and as you know, as you get close to graduating, you're thinking about what you want to study. And I knew I wanted to be in a helping profession. So I thought I might be a teacher. And then my parents had suggested maybe looking for a profession where I can make a little bit more money. And turns out it's not that much more money, but there was like a job board at my high school, and there was a speech pathologist in town looking for someone to work in her office for 3 hours a week. So I would go there and make a couple bucks and just like photocopy stuff for her, clean all the toys, do some basic insurance assistance, office assistance. And I saw so many different clients come in and out of her office that I was like, this is a really great profession because I can help people and I get to talk all day. Turns out you have to listen all day too, which is even harder. And so I knew early on, and she had provided me some materials from ASHA about the professions. And I went right into my undergrad in speech therapy and speech language pathology and audiology, and then my master's right away. And then I worked in the public schools for 5 years, and then got not bored, but I wanted to be a little bit more engaged in the brain. So I went to get a PhD. I picked up and went out west to Arizona State University, go Sun Devils, for 4 years, did my PhD. And then now I'm back in the New York City area at a university, and I've been there for 15 years.
Oh, wow.
Yeah. So I think,
wow, I didn't realize you'd been there that long.
I never realized I'd been there that long either. I thought I was going to be there a year or two, but I did this crazy thing to leave New York. And then when I was done with my PhD, I applied to like 18 different positions around the country and only got interviews in New York. So the universe wanted me back here, I think. So
Yeah. Yeah. I can't really picture you in another space, to be honest. That's kind of interesting.
yeah.
You seem like you're the quintessential New Yorker to me, but and I mean that in the best way, not like a condescending way.
I take that in the best way. I appreciate that. I lived in Arizona for 4 years, and one of the last days I'm there, I'm ordering a coffee, and she's like, "You're not from around here, are you?" I'm like, "Nope," and I'm going back. So yeah, the New Yorker
That's
just never left me.
that's great because I'm in Virginia and everybody thinks I'm from Texas. And I'm like, clearly you've never been there because that's not what I sound like. But
Right.
thank you for doing that. So let's jump right into the topic. You know, a lot of people aren't really familiar with metacognition and metalinguistics. They hear this word and they're like, oh, I don't know what that means. So can we dive into just explaining what metacognition is first, and then maybe diving into metalinguistics and talking about what those two distinct definitions are?
Okay, so I get to use a little bit of Greek here, and the word meta in Greek is a prefix we've taken into our language to mean thing. So going meta means to think, and so we go meta all the time when we're thinking about any problem and putting conscious attention to it. So in the world of speech pathology and cognitive therapy and what have you, going meta, being metacognitive, is directing conscious attention to thinking. So if it's metacognition, directing conscious attention to our thinking, how we think, not exactly the thoughts, but like why a thought might pop into our head and then 10 others follow it, and to be able to articulate that and talk about that. And so that would be metacognition, thinking about how we use our working memory, use our short-term memory, how we problem solve, how we remember things, like the tricks we use, different mnemonics, and even to some level, how we store words or ideas or memories. So we don't ever think about that. The thing about metacognition is on the daily, when you're going to work, you don't think about having to stop at a red light. You just do. So we don't have to think about those things because they're more working memory in real time in one part of the brain and out the other very quickly. But when we have our patients or clients or students who are challenged, they might have difficulties with these different cognitive skills. And so metacognitive strategies direct their conscious attention to what they can do to remember the procedures for getting to work, to remember the procedures for completing homework or whatever the context might be. And so metalinguistics, again, meta, to think. So that's thinking about language, and that's directing conscious attention to language and how words can have similar meanings or how they could have different meanings or how one sentence might have two different interpretations. And when we think about the linguistics of it, we could see how it could be, there could be two different, the direct object might be inferred as the indirect object or something like that. I don't want to go too, I know it's late on the Monday. I don't want to get too hyper linguistic, but it's directing conscious attention. So again, to language. So with our clients who are struggling with language, sometimes we might have to direct their conscious attention, even in an example of articulating. In order to make this sound, you have to put your tongue behind your teeth. That's being meta-articulate or meta-articulation. So it's really directing conscious attention to what we're doing.
Yeah, and it's very similar to what I do with a lot of the Parkinson's patients I work with, directing their attention to thinking about being intentional with their speech so that they can be louder, so that they can be more articulate, and they're not letting that pyramidal track just sort of like do the automatic thing that they don't have to think about. Now they've got to switch. And so
Right.
I think that's the thing that kind of drew me to talking to you about this, because even though your background is school-based, this is not something that's a school-based issue. This is speech-language pathology across the continuum of life and across the practice setting. So for me, it made perfect sense to have you as the expert and talk about this.
Thank you. I have imposter syndrome anytime somebody calls me an expert. So I'm just
Oh,
somebody who's
sorry.
read a little bit about the topic at this point.
I think we all have a little hint of that. And I have a friend who we talked about this last week actually, and she said in some respects having a little bit of imposter syndrome is good because it allows you to continue to learn and continue your research and continue to want to grow versus being like, "Oh, I know all the things."
Oh, man. The more I learn and the older I get, the more I realize I don't know any of the things. I know a lot about this much of the world and universe. So it's good. Yep,
Keeps us on our toes, that's for sure.
exactly. I agree with that too. Learning something every day or just keeps your brain active, I think. So,
Yeah, and I think one of the things that a lot of people miss, and again, across the continuum of life, is looking at things that are strategies versus things that are treatment. And this is something that I run into with especially with my undergraduate students when I'm trying to get them in the mindset of, even if you don't go on to graduate school, maybe you decide you're going to be an SLPA, or maybe you want to go into education, you still need to understand how we take into consideration what our patients and clients and students' needs are as far as a strategy versus a treatment goal, because those are distinct things. One can inform the other, but I'm going to let you take the reins on that.
that's a great question. So, I think one of the things so metacognitive strategies are a strategy is just, I hate to use the word strategy in the definition. A strategy is a skill or a task that we teach to clients and patients and students that they will have to use to get to the goal. So the strategy should always be detached from the goal. So the goal is the measurable treatment goal, whether it's speech, language, literacy, swallowing, cognition. And so those treatment goals stay the same. And I think sometimes I see, especially at the university, students will attach a strategy to the goal. And the reason why I don't encourage that is because you don't know if that strategy is going to work, but you still want to target that goal. So, yeah, it looks like you're frozen for a minute, but I'm going to keep talking. And I don't know if it's you or me. Are you there?
Yeah, that was me. My internet just blinked
Okay.
out. Sorry.
I didn't know if it was me. So I was saying, I don't know if you could hear or not, but so the goal is the measurable treatment goal. And then the strategy is the way we support the client in meeting the goal. So maybe the goal for a client, I work a lot with students and they're older adolescents with ADHD. And so sometimes we're working on cognitive strategies, or what the term a lot of people are using are executive functions, but
Mhm.
however you want to call these, their frontal lobe. And if you have ADD and you're 15 or 14, your frontal lobe is not fully developed. So there's a lot going on there. So the goal might be to maybe estimate, how much time you need to get somewhere. And so that's the goal. And so the strategy that you're going to use might be different for when the child's in school versus when they're outside of school. So an
Mhm.
example I worked with a client once that he was really struggling with remembering all of the things he needed to bring home. And this is like working memory, language, attention, all related to that. And we were meeting on Zoom and he had a big fight with his mom that day because they live in New York City. And of course they park the car in the garage. And if you leave something in the car, you have to go down to the lobby, ask them to bring up the car, wait for the car to come up. And so it's more than just going into the driveway. And so he had left his book. So we worked on a strategy: stop, take a deep breath, and make sure you have everything from school. And we were working on that so he would bring everything home from school. Now we're going to use that strategy when you leave the car: stop, take a deep breath, and make sure you have everything you need from the car. So the goal was still the same, to support that working memory, but the strategy changed because by then he was remembering everything from school, but now he had to remember it from the car. So, again, if a strategy doesn't work, you don't want to have to update the goal because that could be time consuming. You have insurance implications, IEP team implications. So the goal is what you're working on in whatever of our domains you're targeting, and the strategy is how you're going to get there.
So Vanilla Ice nailed it when he said stop, collaborate, and listen. It's sort of
Oh,
the same thing, right?
absolutely. And unfortunately, it's that one doesn't work even with our graduate students anymore.
No,
But
no one knows what I'm talking about 98% of the time
yeah.
in my my university students. But I think what's interesting about that is it really does speak to, again, looking at what that patient or client need is and how do we adjust, because nothing used to drive me more crazy when I'd get a graduate student in the setting I was working in, whether it was outpatient or inpatient rehab, and they would set the goal for 50%. And I'm like, everything in life is basically 50-50, right? You got a
Mhm.
50% chance you're going to get to work and not die on the
Right.
way there and not get run over or whatever. I call it playing Frogger when I'm at the university because I have to park across the street on the third
Mhm.
floor parking garage, come down and cross the major highway and hope I don't, get run over by an 18-wheeler or whatever happens
Oh
to be on the
my.
highway. But yeah, it's teaching that in a way that makes sense because a lot of people, and this is I think where people get lost a lot again, is that they think they should just know how to do this. Like they come out of school or they're in school or whatever the case may be, and they're like, "Oh, I should know how to write a goal. It's called a SMART goal. I should know this." And I'm like, "But you
Right.
don't. No one's ever shown you, explained it to you, and ran through what that actually means." So
Right.
yeah, I think
And the
definitely
SMART goal, I mean, it's a good structure for the goal. The thing I want to piggyback on there is the 50% accuracy. So true or false, do all goals need to be measured in a percentage?
false.
False. And that's something I think the students have a really hard time, maybe, and even practitioners. You can do trials to criterion. You could work on a narrative language goal and work on it multiple sessions and then obtain a narrative sample every month or every quarter. And that's how you measure progress toward the goal. So there's always different ways to measure that progress. And so maybe with strategies when it comes to, cognitive or linguistic strategies, we're using these to meet those annual goals. And that 50%, I don't even like 80%, if I'm being honest. Like an 80% is a B minus. And how many people on this call would ever take a B minus without freaking out in this profession, right?
Yeah.
Oh,
Well,
I may as well have said enough. So, and I think for your own self, you don't want to get back to something at 80% because then once you leave the clinic, it's going to regress to the mean anyway. So I like us to increase those percentages, which means maybe decreasing the expectation of the goal, but that we want to make a goal that the patient can meet. And then we go to the next goal, you know?
yeah, and a lot of times what I would do is do 85% and put the level of assistance at a higher level, and then that's the part that I adjust in a
Mhm.
short-term goal format versus the long-term goal, which I would write more like you said in a not with a percentage, more of like a in this particular setting. So say you want to get back into your community as an adult with aphasia, you might want to be able to communicate biographical information at the community level or whatever, and your long-term goal is a little bit for adults, it's not a year. It's usually about 4 to 6 weeks depending on what your setting is. But I do think that it makes a lot more sense to write it that way. And
Mhm.
for some reason, it's not taught that way. And university programs vary so much from clinical instructor to clinical instructor. And even for me, I remember going out into the off campus part of it, and it was completely different than the on campus part of it. So I think that's a good valid point too, because a lot of it is just, again, educating yourself, continuing to do the work, continuing to seek out whether it's mentorship or really good continuing ed so that you can learn that maybe the way that were taught isn't the only way to do it.
Right, right. I think especially when you're in grad school, you can't really, I mean, obviously nobody could see into the future, but you can't really see what's going to happen. I do a lot of trainings in schools and I can see that these are people that took a literacy course, took a child language course, they're in a school, but now they're in the context and they need additional strategy. So even though, well, you should have learned this, that's never a good way to get anybody to do anything. And to your point about the goal 85% and then adjusting the scaffolded level, or
Mhm.
that's that's an acceptable way to do goals. That's your way to do goals. It might not be everybody's way to do goals, but
Yeah.
that's the other thing is you develop your own style. And then of course you have insurance and what have you. But it's funny you said as 4 to 6 weeks, because in schools, which is my primary area, the IEP is now that annual goal. So we want children to meet that goal within a year. And
Yeah.
so there isn't any short-term goals. So if you have the goal, and you could even say like this is the goal for this school year, and it'll be completed within the first, 6 months or something. So there's things you could do that don't break, that stay within the law, meet the child's needs. I guess what I'm trying to say is that framework of like long-term goal, short-term goal, objective, it might create too much work, and maybe just get that goal for 4 weeks, which we could just start calling them treatment goals,
Mm-hmm.
you know?
Yeah. Well, and then unfortunately for us, that's medical. It's driven by insurance, and they want
Yeah,
long-term goals and
they do.
short-term goals and progress notes. And I would love it if I could get a whole year with a TBI patient. That would be
Oh
fantastic. But
yeah, yeah, you don't get that. Yeah.
no, no, sometimes and I joke, I've probably said this 1,000 times on the podcast, but a lot of times it's 4 visits to start, or maybe 6 if you're lucky, if they have really great commercial insurance. And it's like, I'm good, but no one's that good. I'm not going to get you back to where you want to be in 4 visits. 4 45-minute visits is, that's a joke. So
Yeah.
it's just not cool.
You're barely getting started with that. I'm getting frustrated just listening.
Don't do it.
Yeah. So that's why I do think strategy approaches are good metacognitive metalinguistic strategies, because what we can do in that time is get to know the client or patient, and what do they need to do immediately? They need to return to work. Maybe it's procedural and they need to be able to remember the steps to get to work, or to make a cup of coffee. We could teach them a strategy for, you could see how out of the loop I am. I don't even know some of the adult type of
No,
skills, but
that's
yeah,
perfect.
but there's 5 steps for teaching a strategy. What, do you want to hear them?
I do.
You do, or were you going to ask me that? I wanted to get to it. I
No,
thought
I
it was
want
a
to
good
know.
time.
I want to know.
You're on the edge of your seat, aren't you?
Mm.
Okay. So anytime you teach a strategy, the thing I like about strategies, they could be contextualized to the patient. They could be made by the SLP or generated from the client. Like if they come up with their own keywords, but you want to discuss what the strategy is. You want to model how they're going to use the strategy. Then you want to help them memorize the name of the strategy or the steps for the strategy. So discuss, model, memorize, and then support it to independence. So it's really, and so that's like, you have that short-term objective. You want to give them a strategy. And if you're consistent with that, the strategies take off. And then I think the thing to know about a strategy is strategies are not meant to be used forever. They're meant to be
Right.
used until the skill becomes innate. And I don't think that's the right word, but internalized, crystallized. And so the way you measure the strategy is if they stop using it, so the skill goes up, and then the number of times they need to use the strategy goes down. It's become part of that. An example is like when we learn to tie our shoes, they do that whole, the rabbit goes around the, I don't even know that one. I just learned how to tie my shoes. But you get what I'm saying? There's like, you make a bunny ear, there's a whole
Bunny
story
ears.
you do. But what
Yeah.
is it? Do you know it?
I don't, because I taught my kids how to tie their shoes like I was taught, which was make the loop and then do the thing and tie it around and pull it through. But now it's like 2 bunny ears and you do that, and I don't know.
Yeah. But that whole
It's
thing,
kind of
and
like
so,
the new math. I don't know.
yes, exactly. And so how old are your children now?
Oh gosh, one is 32 and one's 29. So,
So
and I don't know how it's
actually,
possible because clearly I'm 39. So
I know. How did that happen? But
I don't know.
I hope at their age, do you think they're still doing do you think they're still verbalizing, I gotta make the nod and then do the loop, or they're pretty good tying their shoes?
I think they're good. They
They're
don't
good.
live here, so
Yeah.
that's good news. Somehow I
So it's,
kept them alive until they moved out and,
there you go.
went to school and stuff. So
That's it. But
here's to me.
yeah, good for you. And I'm sure you taught them lots of strategies along the way.
Yeah. Yeah. We were just, this is probably a bad segue and we shouldn't get off on this, but I was talking about the whole announcement of Tylenol and the autism today. And I said, well, I did take Tylenol because that's what we were told we should take when we were pregnant because you don't take Motrin. And so I was like, well, I mean, our kids are, and then I went, huh, one of them, I'm not sure. And it kind of became like we were laughing about it and we were talking about some of the things that I won't say which child because I have a girl and a boy and I don't want
Okay.
them to like figure out who I'm talking about. They don't listen to this anyway, so it's fine.
Okay, so that's good.
But anyway, it's just, it's interesting how things like that pop up and you're like, huh, interesting. But one thing I really wanted to talk about, because again, this is another area where I think people really get lost in. I learned speech language pathology in like the 4-part therapy session, right? So we did expressive language, receptive language. When it comes to verbal language, that we did reading and writing, and so that was typically the old model of how I was taught our sessions should look like for a client with a language disorder, particularly aphasia. But what I've seen as the years have gone on with other clinicians is that a lot of them don't include reading and or writing as part of their therapy at all, unless the patient or the caregiver specifically says, I had this skill set and now I don't. So let's talk about how we begin as SLPs to support writing as part of our speech language therapy. Because again, this is one of those things that's across the lifespan. I see it with my TBI patients too sometimes, depending on what their cognitive skill set is. And like you said, executive functioning or their ability to just decode language and then use it
Mhm.
in a written format. So how do we get to that space where we're incorporating that in what we do?
So I think this is a great question. And I think your framework for language therapy, receptive, expressive, reading, and writing, I like that there was the 4 there, but I want to take away the receptive and expressive for a minute and say, as language therapists, language scientists, language pathologists, we work on speaking, listening,
Mhm,
reading, and writing. And
mhm.
if we think about it, speaking and writing are expressive language,
Yeah.
and listening and reading are receptive language.
Mhm.
And so if we're really good at working on the speaking and listening side, but in a modern era, especially, before smartphones, we would say maybe if you work in an area that's a lot of reading and writing, we need to focus on that. But most of us are engaging with work and socially by reading and writing on the phone. And it's a totally different register than how we read and write for being a lawyer or a speech pathologist. So I think if we really are habilitating patients, especially adults that are going to be using the phone, that reading and writing is right there. So at the simplest level, if they're going to communicate via text message, they certainly need to know how to engage that language, and whether they're using speech to text or their thumbs, they're writing. It's just
Right.
language that's in a form that I could read. That's all it is. So it's oral language with a twist. That's but so I think that that's really important to think about that. I think as someone who has developed an expertise in targeting writing, like I'm a speech pathologist. I don't know if I would ever be able to work with patients the way you do, with adults with aphasia, or I could certainly not do like a swallow study. So we all have these degrees, but then you start filling in your expertise. So I could definitely give some pointers on like how what writing is and how we can consider writing, but it is a complex task, just like when we learn language is a complex task. The one more thing I have to say about that is, so we have speaking, listening, reading, writing, and then we have 5 domains of language, which are phonology, morphology, syntax, semantics, and pragmatics or discourse. And so those 5 levels of language, you see them in speaking, in listening, in reading, and in writing. So I think that whole divide of receptive, expressive language, it's an artifact of many different things. But when we read the science and how we study language, we're really more interested in those 5 domains of language and how we use them to listen, to speak, to read, to write. So even stepping back further, when we're working on language, is this a person where you're working on morphosyntax, or you're working on semantics, which we kind of are always working on that, or maybe you're focused at the discourse level or the subword level with phonology. So and then if you're targeting that, you should really be targeting it spoken language, spoken and written language. So it's kind of a different way to think about that. That receptive and expressive also, a lot of the standardized tests we use measure it out in expressive and receptive, and then those end up informing how insurance will bill and
Yep.
how IEP law is written. And I don't know if you know, but 1.5 standard deviations below the mean is a magic number that qualifies you for services. Well, I could tell you 5 tests that would not work on, where it's a higher number that qualifies you because it's test specific. So sometimes those things like receptive versus expressive language are artifacts of how we do things. And so it's good to step back and go meta clinical about how
Mm-hmm.
did we get here, and then we could start fixing that.
Yeah, and I think you know this, or I think you do. I teach for undergrad. I teach clinical observations and technical writing, and that's one of the harder things for undergrads because the way that they the way that the education system, depending on where you are, what your standards of learning are, and it varies even within my state from city to city and county to county. You may get a student who came from 2 counties over, because I don't live in a county, I live in the city. They may not have been taught the same way that the students where I live now are taught. And so when you get to the university level, you're getting these students with varying backgrounds, and we won't even talk about how bilingualism or multilingualism impacts that because that adds a whole other bunch of layers. But for, kids who grow up in the United States without a learning difficulty or in the need of speech language pathology services or special ed or whatever, you're getting what we would call our typically developed. Now they're early 20s, and most of the time in my class, they're seniors, so they're getting ready to graduate from their undergraduate programs, and they can't identify a conjunction and a preposition in a sentence.
Mhm.
They can't identify sometimes pronouns. The pronouns have really been throwing the last 2 semesters of students, which is super interesting considering how much of a drive, in the LGBTQ plus community there was for pronouns to be used.
Mhm.
But the thing is, they know the pronouns, but they don't know if it's subjective, objective, possessive, demonstrative. So there's all these little basic things that I learned in 2nd grade
Mhm.
that the students aren't learning. And so it makes it a real challenge for me as the writing intensive course for the major, but also the writing intensive course as a university requirement because of each major has a writing intensive course. So it's been a real challenge for me to try to meet the students where they are and get them up to speed on just basic how to write simple past tense. They don't know.
Mhm.
So I always say I need a t-shirt that says use simple past tense that I can just wear every day to class. 1, and 2, if you have more than 1 verb, it's no longer simple past tense, and it never fails every
Mhm.
semester. It takes some of them the entire semester and 8 soap notes to figure out that they're not using simple past tense.
Yep. And that, I mean, so some of the things you're talking about, I was always got dinged on writing goals because I'm a verbose person. So if I could put more verbs in than necessary, I will. But the more I've been writing, the clearer it's gotten. So I have a couple things to say in response to the many points you brought up. So the first thing is just according to the nation's writing report card, which was conducted through the National Center for Educational Statistics and the Department of Education, which I don't know if you heard, it's being dismantled and not taken away, but they took away a lot of the data,
Yeah.
which is what drives us. So the nation's report card was one of the first things that they axed, not axed like in New Jersey when you ask a question, but axed like with a
Yeah.
anyway.
Like,
So
they chopped it down. Got
yeah,
it.
so just the data, but that data was not promising for writing to begin with. So about 25% of students graduating high school in the country are writing at at proficient or advanced levels. And then basic and below basic, which the nation's writing report card considers unacceptable, it's just at the basic level, is the majority of students, the other 75%. And that is just a sample of children across the country, typically
Mhm.
developing. This is not even for children with learning disabilities. So
Right.
they're graduating high school with, not everybody is a proficient writer, and almost only 1 or 2% are advanced writers. So, and then college, you go to college and then you maybe have that really good writing teacher in English 101 who tells you to use flowery language to describe a metaphor. And that's great for the English language arts. But when you start putting that into your speech therapy reports, the child whimsically and elegantly entered the room. That's not necessary. And that was an actual student that I had to give some feedback to. I was like, these are not subjective, but I love the whimsiness of the observation. So sometimes I think the position we're in at the university level and in our field, we can't say what we thought you should have learned in school, because that's not going to change the fact that the students don't know it now. So, and there's a lot of tutorials and online resources where they can get that. And I think drawing their conscious attention to this writing is really important. Now, when it comes to like prepositions and what did you say, articles and
Conjunctions.
conjunctions and subjunctive. You talked about pronouns, the demonstrative. I'm not sure I could define any of these things, because what's happened in research, in language research, we know that we would never go play with a child and say, okay, come on now, use a demonstrative pronoun. We would elicit it naturally through to being
Yeah.
clever to know, what can I do to get this child to use a demonstrative pronoun? And so you and I and some other people back in the day might have gotten grammar lessons. And we're not really sure that grammar instruction makes you a better writer. But what it does do, it gives you the language you need to be meta linguistic about it. So
Yeah.
when you talk to your students, you can say, okay, I don't see a subject of this sentence. We can't have that common language without saying the subject of the sentence. We've just written a curriculum through a grant. It's finished, and that I wanted to teach the students subject and predicate, and the team was like, no. I'm like, but we have to be able to talk about it. So we came up with ways to talk about the subject, who or what the sentence is about. So every sentence needs who or what the sentence is about. It's
Yep.
going a little bit meta, and then we're not bombarding them with the vocabulary of language. And then the rest of the sentence is what the the subject is doing or feeling. And so that gives them a simple structure. And that was to teach expository writing. So the research says that grammar instruction doesn't give us a big effect size in writing. And so that's why that's taken away. But then if we want to be metalinguistic, we have to find other ways to talk about the sentence. And I think in that example that you gave, that passive and active voice and being clear, it's almost having to diagram a sentence: subject, verb, object, write things in the order they happened. And I always tell this to students: read it aloud, because when you read it aloud, that's when you hear it. And I do that to this day. I mean,
I
every
do too.
paper I submit, and boy, do I find errors, and I'm never wrong, which is incredible. But I think I got to all your
Yeah. And
points. Yeah.
the funny thing is, so the reason that that whole undergrad class was being taught to identify those parts of speech was because they were heavy on language sample analysis when the students who went on to graduate school got into their first semester of clinic. So they had already had language development as a course in undergraduate, and they did a whole language project. And one of the precursor, it's actually the prerequisite for my class, is a class where it used to be called English 350, and it was exactly what you said, diagramming sentences. So I had the most complex sentences on the face of the planet, and I would have to turn my paper this way to diagram the whole thing, because one sentence would take up this entire sheet of paper once you diagrammed everything down. So they used to do it that way. And then the emphasis was heavy on language analysis of children's language samples and patients with aphasias language samples. It was just part of the curriculum. And so that's kind of how that became. It wasn't mostly the clinical writing is almost completely separate. So it's still a twofold class. And I think that's sometimes where it gets confusing for the students, because they don't have a strong grammar background. And Kim asked the question, are public schools not teaching grammar anymore, or has it decreased?
So I could get to that, but I want to just say to you. So I do think when I was saying about teaching grammar, and the research has shown that this isn't a strategy that promotes writing. It's what they are finding is strategies that say like construct a sentence with part that would be a better way to do it. So the
Mm-hmm.
grammar instruction, but I also believe that a speech language pathologist has to know language well.
Mm-hmm.
So I think a speech language pathologist needs to know parts of speech and grammar, just like a surgeon needs to know anatomy. And so when we have our students that they're taking language development in preschool children, and we all do that big language sample, what we never do is go meta and say, by the way, this is also improving your own language because now you're paying attention and we all use the same language and we use these language function categories, content categories. We use this grammar. So I think one of the strategies is to metacognitively direct conscious attention that our students do know a lot about language. Now let's put it into your own writing. I'll tell you
Mm-hmm.
what the problem is. Anytime I give examples, because I teach a course on like language and literacy disabilities. And so when I say it's the same way you guys are learning in my class, I think sometimes they get offended because they think I'm calling them learning disabled, which
Oh no.
it's, you know what I'm saying? But that's not the
Yeah.
case because we teach normal language development in typical language. And so if we know language and grammar really well, to apply it to other children, well, why not direct that conscious attention to your own writing? So I think there's a way that we could parlay that whole language development, language analysis with, okay, let's do a language sample on our own writing samples. So they could say, oh, that's a good one.
That is a good one.
Have them analyze their own MLU and content categories and things. But also writing takes practice. So in
Mm-hmm.
schools, on average, they're spending 20 to 30 minutes a day writing. And we know that there's so much more that happens in a school day, but 30 minutes a day writing is not enough across a public education, 12 years to become proficient. So um, and now we're at the dawn of AI, so we'll see what happens with that. Now, what was the question? Oh, are they not teaching grammar in school? So the grammar instruction that we learned, subject, predicate, which to be honest, I don't even know if I could define a predicate, but I like better when we talk about subject, verb, object, agent,
Yes.
action, object, because
Object.
that
Yeah.
gives us a meatier sentence. I think there are some teachers that will teach this. What they are teaching is morphological awareness. So morphology is so hot right now. It's so in right now, and they're teaching root words and prefixes, affixes, and suffixes. Because in our language, in English language, if you know the utility of those, can take you very far, and that's a very meta-linguistic way to teach. But like all things and in the world, these trend and fad and they come in and out of fashion. And so they're teaching kids literacy, reading and writing without the emphasis on grammar. So they might know how to read and write, but they might not know where the subject or predicate is, if that makes sense. And that's
Well,
okay.
yeah.
Yeah.
Yeah. And the one of the things that even like within my own household that we've talked about is my husband didn't grow up where I grew up. He's from a different state. And so the way that I learned reading and writing was more of a whole language. So we had sight words, but we also had phonology. We could sound, we could sound out words, but we also had our core words that we had that were, really the more common stuff like the and all that.
Mhm.
He didn't learn phonology. So it's always, even as an adult, it's difficult for him to find the ability to like sound out a new word, especially if it's, a little bit more complex or something like that. It's always been more of a challenge because he wasn't taught that way. He was taught that sight word, vocabulary word, and it was just a different method of instruction in a different state. And so Kim again mentioned that her kids are in Catholic school and has a third grader who's dyslexic and he's learning to diagram sentences. Oh, that's amazing. In third grade. That's cool. And she said, I think this is helping him.
It's good. Well, because he gets to the diagramming sentences is meta-linguistic. And
Yep.
I mean, if she's on this call, she's a speech pathologist. So she's going to, of course, put that language science onto the child. That's a great opportunity to be metalinguistic, I think that that's where we have to use our evidence-based practice approach, because some kids, one of the number one recommendations they make for kids with dyslexia is don't make them take a foreign language. And they'll even in the IEP say they are exempt from foreign language requirements until you meet the kid that's dyslexic and really good at French. And so
Yeah.
then you have to change your mind about it. So there is no one rule. It really becomes child specific. So where one child with dyslexia may be good at getting that metalinguistic, and I could see where someone with dyslexia likes to make sense of language, but I could also see where it'd be really frustrating for someone. So it really is specific. But it's funny when you said that, Renee, you said, I learned whole language. And when you said whole language, I was like aghast, because whole language when I was working in the schools was whole language was the reading by osmosis approach. But you defined whole language as including phonology, syntax, semantics. So, and that's really true. That was always my counter argument with whole language. Well, we do whole language approach to reading where it's sight, words, and context and pictures. And I would say, but sounds are part of language. And so if you're saying whole language, you have to include the phonics and the phonetics, and not the phonetics, the phonics and the phonology. And I'm that to your point, your husband doesn't have a strategy to sound out words. And even more importantly, those sounds are what we're going to use to build those morphemes. And so when you get into high school and college level reading and you come across words like photosynthesis, metamorphosis, where you have to glean the meaning from those roots, you can't even break down without a phonological base. You don't know where those roots begin and end. So that's going to be a challenge for gaining that meaning. So phonics and phonology in the younger grades leads to morphology as kids get older. And English, I got news for you people, is a morphophonemic language. So you need these skills. Yeah, until we write completely in emojis, and then you don't need to sound out anything.
Well, it's funny too, because the writing stuff, I always start the class by saying, if you score between this and this, that's about average of where I would expect you to be. This class is different because you're taught to write creatively, essentially,
Mhm.
right? We're typically in high school and college, we're, like you said, the flowery language, we're analyzing literature, we're analyzing poetry, we're maybe doing some expository writing on a topic, like a political topic, or current events used to be the word that they used for us. And you're learning that, but you still want to be a little bit more flowery in your language. Whereas if I came to work for you tomorrow and I had a patient with a TBI, I need to know you got sick. Did you document in a way that I could come in as PRN and cover your patient and pick up where you left off without any notes from you, without a discussion with you because you got sick and we need to take care of this person? Could I look at your note and repaint a picture of what you did yesterday and expand off that versus me coming in and being like, I don't want to work at this place and cover for you ever again because your writing is crap.
Mhm.
Right? And so that's sort of the difference in my class of how I'm trying to teach them. And they, again, mostly are type A-ish plus, A minus, A plus plus, A plus plus plus. And they
Yeah.
want perfect score on day one, and they don't understand that it's a learning experience here. So I've,
Absolutely.
between saying use simple past tense and you're here to learn, you're not here to be perfect, I probably should make all those t-shirts and start selling.
Yeah. If you knew it all, I mean, if you knew it all, then you wouldn't need to go to school. So you have to be open mind, open heart. But I think there's a great opportunity there to be metacognitive and metalinguistic, because I think what you're touching on is that when we read and write, and let's just focus on writing, when we write, it's genre specific. And so you're learning, most of our students learned creative writing, literary writing, because that's what most English classes are. English classes do teach expository writing, or they're said to, and the literate essays and the essays we have to write can convert. But then you're talking about a very niche genre, but a genre nonetheless, the soap note. And so when we learn these things, what we have to do is maybe direct conscious attention to say, hey, So we're going to learn a new way to write. Even though you come in with these good grades and you're a great writer, we're going to learn how to be very clear, because that flowery language, that's what gets people hurt. And that's what
Hmm.
get people lawsuits, when your report is too subjective. But I think, and this is something I've trained, I trained a high school once. I love when an administrator calls me and says, I need my staff to learn about language. I'm like, I love that, because then I get to go and work with people. And all of these teachers in this high school are like, well, I'm the science teacher. I don't have to teach them writing. I'm the math teacher. I don't have to teach them writing. But you know what? You have to teach them how to write for math. You have to teach them, and yeah, they're writing for math now too, which is good because it's metacognitive and metalinguistic. But writing a science report is its own genre. So yes, every teacher is a literacy teacher in the sense that we have to teach them technical writing for speech therapy. Then we have to teach them SOAP notes and then writing reports and all these different genres. So you're not teaching them. You want them to know what the past participle is and the perfect past is to make it easier, but you're going to have to find other ways to do that to clarify their language. By the way, it's all in the APA manual. Nobody
Oh
ever
yeah.
reads that thing, but it's in there.
Oh,
Yeah.
I tell them all the time that if they're gonna cite a source, which I don't really require in undergrad for them to cite a lot unless it's direct video observation and this information came from this video that we watched together in class, then I say, you need to cite it. I'm not going to make you do like an APA formal, but you need to at least give the source credit. We talk about that. We talk about the OWL Language Lab, because they all are like, oh, I found this website called grammarquiz.com. And I'm like, no. We're going to use reputable sources here. So Purdue OWL Language Lab is a great resource for finding out how to cite anything that you want. And then, matter of fact, I'm going to look and see what this title
But I
of this.
just to the point too, the APA manual, if you ever got it, because I'm an editor of a journal, so I do need to have a copy. But it also has writing, like how to
Yes.
write clearly. And so a lot of the tips and tools in there are all the things we're talking about. They might not say present perfect, but they do say simple language, active voice. And I think if you Google APA 7th edition, the
Yeah.
American Psychological Association has a tutorial. I assign that to my students and I make them find 3 things they didn't know about APA. That way they have to really dig.
Yeah.
Uh,
There's one lecture that's ethics and genre. And then there's one that's the meta-linguistic stages of writing that I do.
mhm, mhm.
I feel so proud right now.
It's good. It's good because that's the thing. Like, I mean, you have to write, but writing is, I mean, it's so fun, like, especially if you like to read, but like you get the idea down on paper. That's the first part. Now you have to go back and make sure the person that's not in the room is going to understand it. Boy, is that going meta. You really have to put yourself, oh, and what's the other term we were using? Theory of mind. You
Yes.
really have to take the perspective of the other person. And that young kids don't really have that. That doesn't come in. I think for guys, it doesn't come in until their 20s, but don't say anything. But I don't know, when one has an episode or a CVA, do you lose that perspective taking? Could it be more difficult?
Yeah.
Yeah.
Yeah, for sure. I mean, it could be, and especially for TBI patients too.
Mhm.
We see that because there's often that social disconnect of like the pragmatics and things like that, where maybe they don't have the ability to self-monitor their behavior. So yeah, definitely.
Mhm.
And I had a thought on something you said earlier that really resonated too, and then I lost my train because it's almost 9 p.m.
It happens. It happens.
Yeah. Kim said On Writing Well is a great book.
Oh, nice.
Okay. That's not one I've heard of. I'll have to look that up.
Is
Yeah,
that
because
for, is that more for like people who want to write as like creative writers, or is that for educators? I don't know if Kim heard that, but anyway, I'll look it up. I can answer my own question. Never mind.
yeah, well, it's so interesting because again, I think that that whole I know what it was about. You were talking about subject specific writing. So writing a science report is different from how we write for English.
Hmm.
Universities at least at my university, we used to have a undergraduate entrance writing exam and an exit writing exam because they have a writing center on campus. And so you used to have to pass both of those components to be able to graduate, and they did away with those, so they don't have them anymore. And even when I was in grad school, we had a graduate writing exit exam.
Wow.
That doesn't exist either. So I think that was probably part of the reason I was drawn to teaching that class, but also looking at it in the ways that I heard you describe it in some of your work, which is why it was so important to me to have you on to talk about this, because it's not something I think that is well talked about in our field. I think there, like you said, there's a lot of niches in our field,
Mhm.
which is it's a good thing because we have people who are very specialized in certain areas, but we miss some things along the way if we're not listening and learning and trying to get back to the root language, because we get so bogged down in our day to day of meeting insurance requirements and doing this
Yeah.
for the IEP and going to this meeting and making sure we're eating right and exercising and drinking water and
Hydrating, yes. It's good. Yeah.
yeah, there's so many things, and it's easy to kind of get lost and kind of forget those basics, right? Those things
Yeah.
that we know. It's back there. We learned it somewhere. It's in that filing cabinet that, as we get older, that filing cabinet's all kind of jacked up.
Oh my God. I could picture mine with like papers falling out of every drawer. But I think that yeah, that just I think writing too, like we work on oral language a lot, but sometimes just throwing a whiteboard in and writing out what you're doing is a way to go meta, and it's also visual support, and there's a reciprocal relationship between these things. And going meta with our students to be like, hey, you learned about grammar when you did your language sample, now put it into your own writing. We're off to some good starts. And then somebody asked for another strategy. I think we have time for one more. This is a great one, and this is one I think we could use across the lifespan. It's a writing strategy called stop and list. Stop. Oh my gosh. Stop, think of purposes.
Mm-hmm.
Yeah, it's stop, think of stop. So you're about to write, stop, think of the purpose of the writing, and then list. List ideas, sequence them. So you just write down little ideas of what you want to write, and then you put them in whatever order you want. And that's a fun thing to do with kids because they love, oh, the last thing I wrote is going to go first. I'm going to put a number one there. I will teach you, though, that I will say for young children, elementary school, and maybe even some middle schoolers, they don't know how to outline. So they'll start writing full sentences or an essay. So you do have to teach them how to just put down a couple keywords. But stop, stop, think of purpose, and list ideas, sequence them. And this is a great way to plan your writing. And then from there, and that you could do across the lifespan.
Yeah, and that I know what it was now that it brought me back to was really drilling into students that they have to proofread their work. They have to give
Yes.
themselves time, because what happens, and we do this as adults with text all the time, or at least I do. I can't speech to text because for some reason Siri doesn't get it's bizarre. The things that come out of my mouth are not what gets typed. But what we have to look at is, I'd say this over and over and over, is give yourself time. Don't rush the assignment and do it 20 minutes before it's due at midnight. Start when we are done with this observation so that you have time to write, like you said, list out how you want to write it, but also just like do a really rough draft just so you can brain dump all those ideas. And then you give yourself time to compose it, but then you want to give yourself time to sit and marinate on it overnight so you can go back and reread it. And like you said, you catch the errors. And I say that all the time to the students too. Not only proofread, like read it, but read it out loud. Because when you read it out loud, you're engaging a different part of your brain and your language center, and you're going to hear the error. If you're comfortable, do a peer review. Have even if it's your significant other, your sibling, your friend from class, if you're comfortable with that, because guess what? we peer review each other when we're journal writing and when we're submitting proposals and grants and all the things. We peer review. And the undergrad students are like super uncomfortable with it, but I've started just being like, okay, be uncomfortable with being uncomfortable because you're going to learn from that.
Yeah, and
And that's
there's
okay.
yeah, I think that peer reviewing, they have to, I always tell my students, make a friend in class and do, work together on stuff, study buddy. But that the peer assistant writing strategies is a big, highly valued strategy, good evidence base. And there's protocols, especially at the college level, to teach it. So I
Mhm.
think that you get the ick from the undergrads because they just don't have a strategy to do it.
Yeah.
So you need to teach them a framework for it. But I think that's a great thing. And that reading aloud too, when you write something yourself, it makes perfect sense. And when you read it not aloud, your autocorrect is going to autocorrect what you thought you wrote. But if you read it out loud, you got that extra loop of the brain that's going to turn that autocorrect off. And then there's just some students who write sentences and they're like, it made sense to me. I'm like, all right, then we have to step back and really dissect what's going on. So, yeah.
Kind of like with singing, if you're familiar with the tune, right? So say you're watching like American Idol or The Voice and you're watching it and listening at the same time. You have a perception of one, what it's supposed to sound like, and two, what the lyrics are. So if you close your eyes and you're only listening and you're not watching, you're not picking up on their nonverbals and you're not doing any kind of lip reading, but you're only listening, you're going to hear the error. And it's the same for me with writing. If
Yeah.
you, like you said, you're engaging just a different piece of it, and it is the metacognition, the metalinguistic engagement part that you really get, I think, a lot more out of.
And I do think that being like you write and then you need to take some space from it because writing is very working memory intense. So if you write it and then proofread it immediately, it's all still jumbled in the working memory. Get a good night's sleep, have a cup of coffee in the morning, read it, fresh eye. You'll probably pick up some of the ways to improve it. I don't like to say pick up errors, but find ways to improve. Yeah.
I like that.
Yeah, yeah, yeah.
Well, Anthony, this has been great. You're always such a great presenter, and you just, you make this accessible for people, and I really appreciate that about you because it's like smart people talk, but also like accessible smart people talk. So I love that.
Thank you very much. I appreciate that. And thank you for having me. This was fun.
Good. I'm glad you enjoyed it. We really appreciate you being here with us. Anthony, great to see you. I hope to see you again soon.
Thank you. Bye bye.
Take care.